Nearly 20% of all sports-related injuries involve the lower back or neck. Fortunately, with direct access to physical therapy, you can avoid the need for medicine or invasive surgery to fix the problem. By working closely with your physical therapist, you can treat the underlying issues of your injury by strengthening the affected areas and minimizing the pain. Find a physical therapist near you and schedule an appointment today.
There's a bill being considered at the State House, and if you don't know about it, you should, because its passage would affect the way you practice. It would expand your patient treatment capability, and it would put you on an even playing field with other healthcare professionals. The legislation would provide physical therapists with the legal authority to diagnose their patient's condition. Current law does not permit a physical therapist to perform a diagnosis, although many currently do. The bill would also allow physical therapists to order diagnostic imaging tests for their patients from a healthcare specialist legally licensed to administer and interpret such tests. The ability to order diagnostic imaging tests will assist the physical therapist in determining the best plan of care for his or her patient. Clearly, there is no compelling reason why physical therapists should be prohibited from diagnosing their patients or from ordering diagnostic imaging tests for them. Consequently, an update to the Practice Act in the Ohio Revised Code that clarifies the scope of practice and reflects the current trends in physical therapy is long overdue.
Physical therapists are often looked at as primary care providers, and without the ability to make a diagnosis, they often can't then coordinate the plan of care that's necessary for their patient. And so all the bill does is clarify what you're really already doing, and that's determining a patient's physical impairment or functional limitations, and then ordering appropriate treatment.
Thanks to the efforts of OPTA, its staff, and its lobbyists, the bill has made it to the House Commerce and Labor Committee. But without your effort, that might be as far as it ever gets. So what can you do to make sure that this legislation, which impacts you and your practice, passes through the legislature and gets signed into law?
OPTA has a Legislative Action Center on their website, so what our members can do is first go in there, find who their local legislators are if they don't know, and then send them an email about the bill. The second thing they can do is follow up with their legislators after that initial contact and say, hey, here's why I support the bill, here's why it's important to the profession, and here's why it's important to our local community. So we are asking our members to be active now, to contact their legislators now, to be proactive now. It takes everyone to do that. Grassroots efforts are extremely important in getting legislation passed.
If you have any questions or need any assistance, your OPTA staff will be happy to help. But again, it's really up to you. If you want the state of Ohio to recognize, authorize, and support your ability to practice physical therapy and treat your patients at the highest level possible, then let your legislator know repeatedly how important it is that this legislation gets passed. Find all the information you need about this legislation, including bill content and talking points, on the OPTA website, ohiopt.org.